So really nice to be here at the 5th World Social Marketing Conference. 5 years. USAID, we're actually celebrating our 50th year. And I think it's important to say that USAID and social marketing were kind of born together. We certainly were there at the beginning, using and applying a lot of the techniques and tools of social marketing for development, not just health, other areas of development as well. So our roots are the same. And I think it's important that we look at those roots and also look at some of the trees that have come out of that and the sustainable development goals and what those mean today for social marketing, because the world is changing. Social marketing, and I'm not an expert in social marketing, I'm partly an expert in criticizing social marketing. Social marketing came out of huge advances in marketing, huge advances in communication, and also advances in the tools applied to lifestyle behaviors. And the understanding or the realization that these kind of things worked. We just saw the latest example of success, and we've got success in social marketing all around us. The other part, I think, that we saw at the beginnings of social marketing was we were really looking at population-level change. It wasn't just changing the introduction of a social good product, but it was looking at very large lifestyle changes, normative change, the type of social change that's going to influence things like democracy, or influence things like equality, or women's roles, or gender, or violence. So there were early movements in social marketing that were looking not just at specific behavior change or products, but really looking at lifestyles and values. So those are the roots of social marketing, and I'll go here to sort of where we are today. But I first want to start with a quote that came from 1952. Why can't you sell Brotherhood like you sell soap? And today we're not just selling Brotherhood, and I think if we said that today we'd say peoplehood probably. But we're looking at sustainable development goals that are really values. No poverty, zero hunger, reduced inequalities, gender equality, peace and justice. These are huge goals. Luckily, we've got evidence. And if you look at the publications and the scientific publications around social marketing, it's just exponential. The types of, this looks in the 1970s, when the first journal articles started appearing, when there were a couple of publications, and then look at you today, the 5th World Conference, and 300 plus peer-reviewed social marketing articles published every year. So that's impressive. It's impressive that you're evidence-based. It's impressive that there's an accumulation of evidence. So I went back and looked at sort of where it all started and looked at some of the early campaigns. And a lot of the early campaigns, obviously, were built around family planning and birth spacing, the incredibly successful mass vaccination campaigns, measles, smallpox, and I'd say today the continued success with polio. Social marketing expanded a lot from USAID in the 70s, focusing on delivery of modern contraceptive technologies. We expanded into India, Indonesia, Egypt, Nepal with family planning, and then the social marketing role in the child survival revolution starting in the late 70s and 80s is huge, looking at things like ORS and vaccines. So we really did grow up together. And then looking today at the expansion of social marketing across the developed world. We'd like to say, coming from Latin America, and I don't know what you heard from my colleague Rafael yesterday, that we kind of invented it in Latin America and then you guys picked it up here. I don't know if that's true, but I think that the embrace of social marketing in Canada and the UK and the US is a real testimony to how the evidence of what works in the application is being taken by everyone. So that's the, okay, so I want to go back there and go back. Today the world is expecting from us and from the developing community and from the social change community even bigger results. If you look at the goals for reducing maternal deaths and reducing child deaths that you see here, those are wonderful graphs. And the basic message here is that by 2030, a child being born or a mother giving birth in any country in the world will have an equal opportunity of survival. By 2030, the levels of maternal mortality and child mortality, child deaths under 5, will all be at the OECD levels that they are today. So those are big goals. The world is thinking not only huge goals like peace and fellowship and no violence and equity, but also real measurable goals in reducing mortality. So I'll get back to social marketing and how that fits in. So USAID, we have a strategy that is very much behaviorally focused and that is very much focused on the equity and reaching the lowest quintile. This is for child survival and maternal survival. When we're looking at the 25 priority, that terrible acronym, ending preventable child and maternal deaths, and looking at the ability in those 25 countries where 2/3 of preventable deaths occur to make real reductions. And when I say preventable deaths, people here ask me, what's a preventable death? Because a preventable death in the US is very different from what kids die in developing countries. And I probably don't have to tell anyone here in the audience that it's basically things like diarrhea and pneumonia, or a neonatal death of a child born without neonatal care. So looking into the future, those are our goals, those are our countries. Looking into the future, those are the SDGs. And you've seen this wonderful graphic, I'm sure. Each of those graphics has, each of those squares has behind it real measurable indicators. They're lofty goals. They're goals that don't only look at specific behaviors and health outcomes, but they also look at kind of the how, and doing it in a way that's sensitive to issues around gender, around inequality, around violence, around peace and justice. So they're important goals. And that's why when I was asked to come up with a title for this presentation, which I came up with a long time before I wrote the presentation, it was saying, is social marketing up to achieving those goals? And is this challenge the challenge of the future for the field? So that's where we're looking to 2030 to say, with these very clear, measurable goals, what's the role of social marketing? Is it up to the task? What can we expect? Can it stretch? And can it stay true to its bottom line? And the bottom line meaning going much beyond a very specific, perhaps product base or looking at a specific segment of a market, but going into these larger, excuse me, both behavioral and social goals. So the advice, which is, I think, the advice we would have given or we would have gotten 50 years ago when you started USAID or started social marketing is think big. Don't start with a small idea of what can be accomplished with social change and behavior change, but think big. And that's where we've started with our work today on the 25 priority countries and these ambitious goals for reducing under 5 in maternal deaths. Thinking big in terms of integrating behavior and behavioral factors into all of the health programs that we work on. So if you're looking at service delivery, if you're looking at demand creation, if you're looking at interaction in a household just in terms of dynamics or policy, you've got a behavioral lens. And the goal is specific behavioral and social changes that are going to have direct impacts on mortality and morbidity. So we all have these nice graphics with circles and how we get places, and they're important. I think they're important because they help not so much from and in this case, a funder's point of view, but I think in terms of how we dialogue with countries, how we dialogue with partners, how we start a program going, and how to say, this is a science, it's an art, and there is a system to it. So these are the types of models that we use when we're looking at accountability, both in terms of results, but also in terms of proven evidence and methodologies to get there. So this is just what one of ours is, looking at how you build from the behavior onto a specific integration guide looking around a health area. Because we always have to remember, and when, I work with a lot of doctors, and it's hard when you've got hard biomedical tools to justify what at times will sound like a very soft social science-y value thingy about how you're going to accomplish a very serious health outcome. So the first thing I think we have to come across with, and I think it's something that our dialogue across the field, and it's so nice to see our colleagues at CDC who have so embraced the behavior, the social and behavior change as a crucial health area. The first thing we have to focus on is to build on our successes and to remember that health matters and that behaviors matter in health. And the behavior that is the behavior to take up smoking, or the behavior to take your kid to be vaccinated, or the behavior to wash your hands, these are all very simple behaviors. The second, in terms of the remembering our successes, is the central focus of social marketing, which is what marketing really brought to this field, to the whole field of development, which was the focus on the needs and desires of the audience. You're not starting just yelling at people and telling them what to do, and we did it. We spent a lot of time doing that in health sometimes. But to look at, as the case of smoking reduction, what matters to the audience is having to live with the sequelae of the disease, or the emotion of seeing what things happen when you see a small child that could have lived and that died for very silly reasons. So I think it's looking at the desires and the needs of the audience. And then the marriage of the long-term social benefits and the immediate benefits for communities, families, and individuals. The other, I think, lesson of what matters and what success is built in is the question of integration. We forget that sometimes. We at USAID sometimes get a little siloed. We work over here on commodities, or we work over here on training, or we work over here on getting some kind of service improvement, and not looking across the field at the integration, both of the behavioral components, but then how these things work together, and how you can integrate a behavioral lens across that. And that comes into behavior change. It comes into using an integrated approach for communication, service delivery, and then getting in some of the newer fields on human-centered design and behavioral design, and then getting into an area which increasingly, I think, is coming to the forefront in the Sustainable Development Goals, which is community engagement, and how the levels of community engagement are really going to make a change for how your program is set up and how it's run. And last but not least, and it's something that I have to focus on every day, because with increasing pressure on funding and showing the effectiveness of where a foreign aid dollar is going, we have to focus on evidence, and we have to focus on showing the efficient use of US taxpayers' money for these programs. So we got a new landscape out there. There it is, whoops. And the new landscape, very much, we're all sitting on the communication revolution. It's become a cliche to say that, but we are. The marketing revolution, and I think it's safe to say that we're learning from you at USAID. We're not the experts. We're trying to learn from you. And the new community tools and approaches. So I'm going to look at these going forward in terms of 3 themes. The theme of innovation, the theme of kind of the big picture and how we have to look big, the theme of integration, and then kind of a closing thing. So innovation. Innovation, we've got new products, and a lot of you, I think, have been part of the new products that are being developed and marketed today. Microbicides, chlorhexidine, the cyanopress. These are some of the most just recent, I think, new products that have come out in the public health field and that have been very much at the benefit end of social marketing. We've got a lot of new disciplines we're working with at USAID. Microfinance, what does that mean for social marketing? I had to ask somebody what this meant, but now I know. Distributed ledger technologies. What does that mean for social marketing? New communication possibilities, and you all are at the forefront of that in terms of social media and digital. New measurement tools. We're very keen on this. We are tired of waiting 5 years to know if something worked. We're tired of putting a lot of money into a monitoring and evaluation system that's not telling us where we're going. We're tired of not being able to use regularly collected data, routine data from systems that can feed into our programs and help us get a continuous improvement on them. So we're looking really closely at new measurement approaches and the impact on our programs. And then new communication innovations, real virtual communication and the ability to use that. When I started working in this field, we were excited about radio. We're still excited about radio, but we're excited about a lot of other things as well. And some of the things we've forgotten that used to be excited about. Whatever happened to educational television, for example? Remember? We spent a lot of time on that. So the big picture. Marketing often focused on a single brand or product. We're looking at expanding that. Social marketing's aim is to expand market access broadly. Total marketing approach, very keen. We're working on that and love the idea. How can we expand that to look beyond at some of these more intangible equity issues, some of the more intangible issues about gender? Market segmentation, you all taught us that. Can we take that further? Expand private sector participation, and I think this is something private profit, private nonprofit, really looking to get the types of partners that are working in achieving the health goals much broader. And then drawing on governments, NGOs, community-based organizations, faith-based organizations to expand the picture. And using total market approach across equity, gender, and most important, sustainable development. Because this is the 5th World Conference. We will be sitting here at the 15th World Conference, I hope, and hoping that a lot of the types of programs that you all are putting into effect now will still be running without you, that will be running on their own in countries. Okay, big challenges, integration of behavioral approaches and services. At USAID, at least, we've used social marketing and even behavior change much more on the individual and community level and have not used it as much or as effectively as a part of something that should be routinely integrated into service delivery. We're seeing a lot of the issues around access and use of services have not a lot to do with the fact that the services are there or not. In many cases, the service will be there, but the type of care people are given, the type of disrespectful care, or the type of problem that a mother has when she comes in and gets yelled at, those are service issues. Those are, how do you do a good marketing approach on your provider? These are the places where I think we see a real frontier in integrating social marketing. Social franchising and community-based delivery of service, which is another frontier. So one more thing, and that's the last, elevating the types of behavioral approach to the highest policy level. Get governments, get countries to support this. There's a history of this in the early days of social marketing. I'm not sure if we're still hitting that level, if we're still having those dialogues at the policy level, especially in developing countries. I think we've got great successes in developed countries, but not necessarily. So we need your help. That's the last call. To push for behavioral intervention at the national level across health portfolios to integrate services, policy, commodity logistics, community, and communication approaches. So thank you. Thank you for all the work you've done in public health.